If we look at the function of the glomerulus, okay, that's what we have in this diagram here. All right, so here's our afferent arterial, efferent arterial, peritubular capillaries, right? So one capillary bed, two capillary beds, that makes it a portal system, like we talked about yesterday, okay? So that's the blood end, all right? So we have blood that enters the afferent arteriole. We give that amount of blood a name. That's called renal plasma flow. That's how much blood enters the either the kidney or the nephron, depending on how you're looking at it. 625 mLs per minute, that's the kidney, okay? So that's how much blood flow enters the glomerulus, RPF, renal plasma flow. Now, some of that fluid that enters here, that fluid that is plasma, right? Some of that fluid is going to get pushed through the filtration membrane, okay? So we call that glomerular filtration. The amount of fluid that exits the glomerulus and enters the capsule, we call glomerular filtration. The rate at which that happens is glomerular filtration rate. The single most important factor in renal function is glomerular filtration rate. And the reason for that is GFR is where we get rid of our waste products, is the simple way to put it, right? Filtration is how we push the waste products out of the body and into the urine. Everything else that happens is refinement. So it means that glomerular filtration is our limit on waste removal. Okay, so it's why the kidney, as we're going to see in the next few days, is going to control glomerular filtration rate quite carefully. Okay, so important concept, GFR. And in our picture here, GFR is the white arrow right here. So it's fluid leaving the glomerulus. All right, so 625 mLs per minute of plasma flow, we get 125 mLs per minute of glomerular filtration out of that. So that's about 20%, right? So 20% of the plasma flow comes out in the capsule as GFR. Okay, now we're not done. So this material that comes out of the capsule or comes out of the glomerulus, we call filtrate. It will become urine. But at this point, it's not like urine at all. So we call it filtrate instead. What makes it not like urine at all is it has a lot of really important good stuff in it, right? Because this is immediately after filtration. So you got a ton of water, ton of glucose, ton of sodium, ton of potassium, all good things that the body wants to hold on to. So we need to have reabsorption. Remember that glomerular filtration is non-selective. Everything small enough comes out. Reabsorption now is going to take what the body would like to have back out of the filtrate and put it back into the blood. So that's this REAB. This is the reabsorption vector here. Okay, so let's look at our numbers again. 625 blood went in, 125 filtrate came out. 124 mLs of that 125 mLs was reabsorbed. All right, you see that? So massive reabsorption in the kidney. In other words, far less than 1% of what is filtered ends up as urine. That's why we don't call it urine at the beginning, right? So where does that reabsorbed fluid and solute go? Well, it goes into the peritubular capillaries. If you remember the pictures we looked at yesterday, these capillaries tend to follow the nephron that they're a part of, right? So as reabsorption is occurring, those materials that are being reabsorbed from the filtrate are put back into the blood that they came out of initially. Same blood vessel, essentially. So the fluid comes out here and is reabsorbed here before it goes back to the heart. Very efficient system. Now, there are a lot of things that can affect these numbers, right? So here we started with 625, we got 125 out, we reabsorbed 124 mLs per minute, which gives us about 1 ml per minute of urine excretion. If you think about if we did not have reabsorption, we would dehydrate in several minutes. right? So reabsorption is really critical. You know, it's the same water as going through the cycle multiple times. Now, things that can affect this system: plasma blood flow can be affected by constriction of the afferent or efferent arteriole, or both, right? So you have a flow coming in, we can constrict this vessel, we can constrict this vessel, and that's going to affect the pressures in here, right? So that's sort of where we're going next, is the way we control glomerular filtration is by adjusting the pressures of the afferent, or the vasoconstriction of the afferent and efferent arteriole. So we drive enough glomerular filtration, but not too much glomerular filtration.